All right, good morning assessors. My name is Camilo Gilabert. I am the treating physiotherapy today for my patient John Smith. He's 55 years old. He was referred by his neurologist. His history started 4 months ago with a gastrointestinal infection, and then he developed GBS. And because of that, he was admitted into the hospital, and that happened like 4 months ago. We don't have much information in this chart, so I just got from the neuro that he wants to assess for the baseline assessment. So it's going to be really important for me to get notes and get the knowledge of what was the previous medical history in terms of medical conditions and medication that he is on, that he was on before this event, and what sort of medication is he using now. I'm also concerned of, and I want to build up the history of the present condition, and also build a timeline of the events, and also we will like to know how long he was at the hospital, what sort of support he needed at the hospital, if he needed physio or had physio at the hospital, how long did he stay at the hospital as well, and yeah, what was the level of function that he had when he left the hospital? And I also would like to know what is his current level of function, and if he's under any sort of physiotherapy treatment since he left the hospital. I would like to build up the social history. How is he doing at home, and digging in for any sort of additional support that he could need. What are his hobbies, and what is his job, and how is he doing in those terms. And we'll be setting together goals, and we'll be digging in some expectations of my patients and start working on that. From the physio standpoint, I'm expecting a patient that is after GBS. Obviously, this is a lower motor neuron disease, so patient usually has start with weakness and loss of sensation, like a glove stocking pattern. That means from the distal to proximal on the lower and upper extremities. So I'm expecting a patient with reduced sensation and weakness, probably weakness generalized, but higher in the distal versus proximal of the extremities. I'm expecting a patient also with reduced proprioception and balance because of the time that he has been probably in the hospital, and I'm not too sure what happened after the hospital, so probably because this lack of movement mean for this patient to have less proprioception and balance. And obviously, if something like that is found in a patient, we will find as well reduced social participation. So to have a proper assessment of my patient and set, like a proper treatment for my patient, a safe treatment, I will bring with me my Pelican belt. As I don't know his mobility status, I will bring my 4-wheel walker and 2 forearm crutches in case that we need it. I will bring with me my modified Borg scale to see if there is any sort of breathlessness, and my report rating of perceived exertion scale, also to see how is the fatigue, if there is any. All right, and I would like to have my stopwatch, and I would like to set in the gym area 1 chair in each side of the 10-meter pathway. All right.